Increasing patient acceptance begins before you even step into the room for the exam. It actually begins the moment that you meet your patient, that they walk into the actual office. So you do the whole whining and dining with your front desk staff, but what can you in particular do? When your staff takes them to the back room to take x-rays for their emergency or for their full exam, what I want you to do, just very quickly, doesn't even have to be more than a minute, pop into the room, introduce yourself as the doctor, and ask them what brings them into the office. Reason being is because these patients so many times walk in with high anxiety, they're nervous, there's the fear of judgment, and you going in, introducing yourself, breaks down that initial barrier. It'll make their visit a lot more comfortable, and you've already kind of created that rapport in just that few short amount of time, 30 seconds, a minute. It's gonna make your